Good morning. It's been a while since we've been together formally, although we've had many conversations. And thank you all for continuing to stay engaged. For the folks at home, as you know, all of the council members were on recess, but they were still very actively engaged in all aspects of the COVID-19 response, participating in numerous briefings throughout the week, wherever they were. So thank you for your continued efforts and dedication. I do want to, as part of the presentation, to walk through quickly to set the stage of where we stand right now in terms of our numbers. Since we last met formally, there's been lots of conversations about schools reopening, the governor moving the state to phase 3, us as a jurisdiction choosing not to move to phase 3. And so just want to provide some updates to those numbers and then go through some of the other key points to address some of the questions that, or anticipating some of the questions that I know that you all may have. So I'm going to attempt to share my screen. It looks like the host is disabled and not allowed me to screen share. I was going to walk through our data dashboard, so I'm not sure who the host of the meeting is, if I'm able to do that, if we could get that taken care of. All right, thank you so much. Okay, so you should be looking at the data dashboard, and this is the front-facing dashboard that we have available for the public, the general public. And so I just want to walk through these quickly to show you some of the trends and where we stand. And so one of the key measures that we've talked about frequently is just looking at the number of new cases. And so when you think back to late June and early July, we saw daily cases dropping. We saw averages as low as 50. And at that time, we moved from phase 1 to phase 2. And since then, unfortunately, we've seen this steady kind of plateau and uptick of cases through the end of July, through August. And as we currently stand in September, or we saw in the month of September, we've seen the cases gradually increase. And so, you know, for the folks at home, again, you know, when there was conversation talking about the state moving to phase 3, it's important to understand that the level of numbers that we saw at the state level and the county level were higher than where we were when we made the statement, the move from phase 1 to phase 2 in July. Now, following the science and the data, you would think that moving from phase 2 to phase 3, we would have sustained lower daily case numbers on a regular basis before we made that move. So we've received a lot of questions saying, well, you know, the numbers are what they are improving. Why haven't we moved to phase 3? Well, one of the big reasons is, as you can see, the numbers are actually increasing slightly. And so over the last week, we, along with the state and other jurisdictions, have seen slight increases in our test positivity as well as the cases per 100,000. So for example, our test positivity had been holding at 2.4%. It currently sits at 3%. And interestingly, the state total has also increased over that time and is sitting somewhere between 3.6 and 3.7%. Similarly, when we break down cases by 100,000, and the reason why we do that is it allows for a more even comparison between population differences. Our number went from 6.1, 6.3 to now it's at 8, and it had gone as high as 9.3 earlier in the week. So I want to make sure folks at home understand that we have not driven, unfortunately, the numbers down as low as we would like. Back to, you know, remember in July, we had a couple of days where we saw cases in the mid-30s. Now, we're not there. And so, in fact, our 3-day average is sitting at 96 right now. And what that means is we, again, are committed from the public health perspective to not let that be our baseline and say, oh, well, we're cool with that. That's just kind of our ongoing total. We want to get those numbers lower to demonstrate at minimum moderate transmission, which, if you recall from our previous conversations, would be a level of 30 to 35 cases per day, and ultimately get that to low transmission, which would represent approximately 10 to 12 cases on a daily basis in our jurisdiction. Now, what's interesting within that, now let me also take a step back, is we've noticed a couple phenomena across the state. The majority of cases now, new cases that are coming up on a daily basis, are between the ages of 0 and 30. So 25%, approximately 25% of those cases are 0 to 19-year-olds, and the remaining are the 20 to 29-year-olds. Now, this is very different from the pandemic when it started, where we saw it skew towards older populations. And so newer cases, higher percentage in the younger population. And what's also happening is when you look at, we're seeing less severity of illness in terms of, we've had multiple days where we aren't seeing any deaths in our jurisdiction. And we're also, the increased cases are happening in the setting of decreased hospitalization. So at this time, we haven't seen a comparable increase in hospitalizations, folks in the ICU, folks showing up to the emergency room with symptoms, and acute bed usage. This number here is the percentage that are tied to COVID and the overall number. That hasn't changed significantly, as well as the ICU bed use or ventilator use. And all of those are proxies to, again, give us a sense of what's the severity of illness in the patients who are testing positive and the symptoms that they're experiencing. Now, the challenge with that is I don't want that to give folks a false sense of security to say, well, hey, everybody gets it, it's fine because, they're normal and they're healthy. Well, because the challenge is we know that young people have older relatives. They come into contact with others who may be more likely and more predisposed to having more severe symptoms of illness. And particularly when we see an increase in cases and an increased percentage in that population, it's a lag period between, being able to see if in fact we're going to see an uptick or a number of cases in those more vulnerable populations and start to see an increase in our hospital utilization by those different cohorts. Now, when we look at the percentage, this is looking at our test positivity. Again, the test positivity number has vacillated somewhere between 2.4% and 3.3%, I think is the highest that we got over the last week. But it's important to note that we have seen an increase, and it's sitting at 3%. What's also been interesting, a phenomenon that has happened since we last met formally, is we have seen multiple days where there have been low test numbers across the state. In fact, there was a day earlier, towards the end of last week, where there were only 9,000 tests resulted. Now, this is much different from where we were in July and early August, where we were averaging 25 to 28,000 tests across the state on a daily basis. Now, throughout this time period, our numbers have held steady. As you know, we rebooted and pivoted our testing program, and now we as a county are close to some of the daily totals that we had experienced, and that's inclusive of the county testing apparatus as well as the entire healthcare enterprise across the county. Now, other data point here, you can just see here's the average number of tests administered on a daily basis. We've got our 3-day rolling average here, and this looks at the number of days within which we have hit our goals. Now, I'm going to stop sharing that piece, and I want to bring up one other additional measure. It's our R0 values here. We have updated those, and they will be updated on our county website. So you can see how the rate of transmission in the month of September we actually saw a peak of 1.4 on September 5th. And the number has dropped back below zero. I'm sorry, not below zero, but below 1, and sits at 0.97. And so in the last couple of days, we've seen an uptick in our rate of transmission. We've also seen an uptick in terms of our red cap numbers. And again, as a reminder for folks at home, the red cap numbers represent the positive results reported based upon when they were actually collected. And we have seen multiple days within the last week of case totals over 100. This suggests that we have seen, secondary to the Labor Day holiday, as well as the state moving to phase 3, we have seen, I feel comfortable saying that we have seen an increase in cases secondary to those things happening. So moving to phase 3 across the state, we haven't, but the state has, and the Labor Day holiday suggesting that we've seen an increase in cases secondary to activities and behaviors during that time period. Now, to go briefly through some updates and always, move to Dr. Stoddard and have time for questions. Since we last met, the governor did provide guidelines, and the health department provide guidelines for schools to reopen and categories to reopen. We met per the state guidelines, we met the criteria for test positivity as we were below 5. We did not meet the criteria for based upon cases as we are above 5 cases per 100,000. And I think a couple of days ago, there was only one jurisdiction that actually met both criteria to be able to open up fully for in-person schooling. Now, since the schools have reopened, as we've talked about in one of our previous briefings, we have had 12 schools. All of them have been non-public schools, 12 schools to have cases involving students, staff, or teachers in some capacity. One of those situations, it has been made public now in the news at the Holy Redeemer School. There was a teacher who tested positive. The classroom of students were quarantined secondary to that exposure, and we have seen and we found out that there's at least one of those students who has tested positive for COVID-19 during that quarantine period. Now, in addition to those 12 schools, we have had 7 other schools have to have some level of quarantine in place secondary to the reporting of a COVID-like illness. And again, for the folks at home to understand, the reason why both of these are reported is per the guidelines, schools have a responsibility and businesses have a responsibility to report to the local health department COVID confirmed cases by lab results, as well as any illnesses in staff members or anyone in that facility with COVID-like symptoms. And when COVID-like symptoms are reported, they're given the same guidance as if it's treated as a COVID illness until it's proven negative by a negative lab result. And so there have been instances where schools have called in and said, we have some COVID-like illnesses present. We've provided guidance to quarantine. And when the test has come back negative, we've been able to provide guidance for them to remove the quarantine and go back to business. Now, from the testing perspective, we have launched our 2 test tents at the Randolph. Councilmember Albanos was talking about his former offices on Randolph Road. That is the site of one of the test tents that we got from the CDC, or the test trailers, and the other one is in the Gaithersburg area at the Lake Forest Mall. They are both operational, and we continue our other test sites, including the Silver Spring Civic Center on Mondays and Thursdays. Now, we have not launched the pop-up testing sites again. We're in the process of doing that, hopefully as early as next week. We have spent the time refining the registration process, the online portals, and coming up with processes to make sure that people get their results in a timely manner. And that's what the team has been focusing on. So the scheduling platform is back up and live. We've been calling folks with their results to make sure they get them within a 48-hour period. And we continue to overperform the mitigation testing capacity numbers and recommendations per the Harvard School of Public Health formula. We have not achieved the suppression level of testing that we've talked about before. And to be perfectly candid, it's a challenge to do that, particularly in the setting that all of the different reopening provisions and guidelines don't support suppression. So it's challenging to balance those two, but we obviously will continue to increase our testing platform to make sure that more folks have access to testing. Our ready responders continue to test out in the community and within the shelter community as well. Now, we have continued to engage with other laboratories to bring them online, to provide support for our current apparatus, as well as explore the opportunity to bring in rapid testing modules in the future, point of care testing. Now, this governor, and as part of his announcement, I believe it's last week, talked about working with a number of other states to create opportunities. I think there's an allocation of 250,000 rapid tests for the state of Maryland. What I can tell you since that announcement, the only information that we have so far is that there will be 250,000 test kits for the state of Maryland, and the priority will be that those tests will be used for nursing home facilities and I believe assisted living facilities. I don't have any further information beyond that to share with you all at this time. Once we find out more, we will work to make sure that you are aware of those prioritizations and dissemination plans. We have met with at least 4 other laboratories to discuss bringing them online to support our platform. We have successfully executed a contract with Scion Labs, who you may recall has been working with us over the last month, thanks to the provisions by the Department of Health to help with that bridge contract. So that is formally in place, and we again have met with at least 4 other laboratories and are at different phases in terms of contract processes and looking through their scopes of work. I do want to also mention the contact tracing piece. We continue to work with our state partners, and when we get those reports, they're sent to Naeem, who's coordinating those data efforts and providing that with you all. The consistent themes that come up is we see large family gatherings tied to positive cases, as well as potential worksite exposures. And so we've said this from the beginning that, we have a high percentage of folks who've had to go to work throughout the pandemic and not been able to work from home and have been at higher risk for potential exposure to the virus. Now, there also was a question, and I know Councilmember Reamer asked about this. You asked about the phone apps that the governor mentioned as a part of the press conference a couple weeks ago. I unfortunately still don't have any more information to share with you. We've not been provided any more information from the state on that or from the governor's office. So we, again, and I'm not dismissing your question, when we get more information in terms of how the state plans to use that, I'll be happy to share that with you. And the last thing I want to highlight or talk about is vaccine dissemination planning. We had multiple meetings yesterday with the National Capital Region health officers as well as the state health officers. And one of the things that we had discussed from the National Capital Region is, again, recognizing our location is working together to design a regional dissemination plan for a vaccine. Now, you may hear on TV that there is a vaccine that's coming in October. I will say this, and I think I can speak for most other public health officials out there, we're not confident that a vaccine will be readily available as early as October. And Dr. Nesbitt, by virtue of her position in DC, sitting at the state level, has been a part of different conversations with HHS to discuss the vaccine dissemination plan for COVID-19. We're still awaiting, much like these other situations, we're awaiting information from the federal level to determine what their prioritization plan will be and their allocation plan to different states. And so we are all waiting for that information, but we are looking forward to coming up with proactive plans to design a strategy where we're working together across the region to make vaccines available when they become available. My best guess, I'm hopeful that we will have a successful candidate by early 2021 that we will be able to disseminate to our population. Now, just one last thing, I keep thinking of other things since we've not met in a while, is again, for the folks at home watching, there have been some concerns about one of the vaccine trials in England through AstraZeneca, and I wanted to make sure that folks understood exactly what's happening. Now, in a standard vaccine, or when you're looking at a new drug therapy or drug trial, we do different phases. And phase 3 is important because phase 3 is a large-scale trial. You're testing thousands of people to see what the side effects of the particular treatment or agent is. And what happens in those trials is sometimes people develop symptoms that can't be explained. And when that happens, the trial is halted. And if it's one individual or multiple individuals, they undergo a full workup to understand if the symptoms or particular illness that they are experiencing is tied to the treatment that they're undergoing or the vaccine or medication that they're getting, or if it's tied to something entirely different that has nothing to do with the trial. And so that's what happened with one of the patients in England. They developed neurological symptoms, and they're undergoing a workup to determine if those neurological symptoms have absolutely nothing to do with the vaccine trial or tied with the vaccine. Once that's determined, if it's determined that the side effects that they're experiencing are not tied to the trial, then the trial is able to move forward and continue. And so this also underscores why there is a formal process in place through the FDA to study the potential side effects and effects of the different medications and therapies, so that we have a clear understanding when we do launch at large scale of what the potential side effects are, and we've done everything we can to maximize the safety of that particular treatment or therapy. So that's why these processes are in place. That's why we don't rush them, because it's important to have a thorough understanding of all of those particular things, so that when we release it to you, we can feel confident that it's safe. I will stop there. Turn the floor over to Dr. Stoddard or answer questions, however you want to do it. I'm happy to accommodate you.
Thank you. Several council members do want to speak. So how about if we say for this point that any council member that wants to speak, we'll go through the list, keep everything to 5 minutes, and then we'll come back if we have time afterwards. So the first person that wants to speak is Councilmember Albernaz.
Thank you, Mr. President. So my questions are specific to Dr. Gales, and you covered a lot of what I was going to ask in your very comprehensive presentation, Dr. Gales, so thank you for that. And thank you again for your and your team's leadership and hard work through the pandemic. I wanted to pivot slightly because it's related, but to talk about flu shots. It's always important to get a flu shot, but in particular this year, if you could just spend a couple of minutes talking about why it's particularly important for residents to receive their flu shot this year, and allay any concerns that people may have regarding the validity of those flu shots because of everything they're hearing in the news.
Sure, that's an excellent point. So get your flu shot. You don't have to wait for October. You can get it now. I got mine yesterday. In fact, and my parents, who've not always been the greatest adherents in terms of getting flu shots, they got theirs last week. It's doubly important because we know, separate from COVID, that flu can potentially significantly impact large swaths of our population, and again can cause severe illness in those who have different health conditions, comorbid conditions, or in our older populations. And given that we're also dealing with COVID in this time, you want to have as much protection and have that on board as much as possible. The challenge moving forward is that if you think back to some of my comments earlier when talking about COVID-like illnesses, well, many of the symptoms that we talk about with COVID-19 are also symptoms of the flu, and it's very difficult to distinguish between the two. And so particularly for those who are vulnerable, at risk, and have comorbidities that could predispose them to more severe forms of illness, it's important to get the flu vaccine to provide as much coverage and protection from the flu, so that you're not potentially hit with both the flu and COVID-19. And so we would continue to emphasize that message, as we do every year, in terms of mitigating the impact of the flu in general. But given that we're in the time of a very similar illness in terms of COVID-19, we want to make sure that as many people are protected as possible to prevent the impact of both at the same time.
I appreciate that. Thank you. And I'm getting my flu shot this week. So it's important for everyone. I just had more of a comment, and I appreciate several months ago, the governor gave local jurisdictions with higher caseloads the ability to make their own decisions, which I believe was wise. But that, of course, has inevitably led to some confusion and frustration that we keep hearing about, we've discussed many times before. And I think it would be helpful, and maybe not right now, but moving forward, to clearly articulate exactly what the state's role and what the county's role is, where it crosses over, who's responsible for what, because I think that has led to additional confusion and frustration, and the perceived conflict that exists sometimes between the timing of when an announcement is made and when we get that information compounds the problem. And so I've heard both of you, Dr. Stoddard and Dr. Gales, individually speak to various groups and explain very well where those lines are and who is responsible for what. But I think an illustration on our COVID page that more clearly articulates who the decision makers are, when they make those decisions. And I know it's sometimes gray, but I think would be helpful. And I also think it would be important to further underscore the collaboration between neighboring jurisdictions, not just within the state, and reinforce why and how those conversations are continuing to happen and how they weigh into our decisions here on a local level. People are just so hungry for information right now and want more clarity on where the goalposts are so that they can begin to plan their operations, acknowledging it's a moving target and it's hard to give them those goalposts. But I think just further providing that context may allay at least some of that frustration that we're seeing in the community. And my final comment is with regards to what we're seeing with schools that have moved forward with their opening plans. This does provide some lessons learned for the county as a whole. When at some point our entire school system, we hope, will open and obviously safely. And so, again, may not be the appropriate time now, but if you could describe some of those lessons learned that we are figuring out in real time right now that may be helpful for others to learn from. And I just want to allay any concerns that are out there. Our county wants to work with you. This is not a gotcha situation. We are all partners in ensuring that our entire community remains safe. And there may be just some disagreements, but there is no disagreement on our concern about maintaining the safety of everybody, especially those schools that have moved forward, because we want to see everyone succeed. So just wanted to make those final comments based on a lot of feedback we're getting in the community. Thank you, Mr. President.
Thank you. Councilmember Rice.
Well, thank you very much. And I'll pick up where Councilmember Albornoz just left off, because I think it is important for us to understand at the very beginning, when we had this conversation about the safety of opening up schools, the ultimate tantamount concern was the safety of all of our residents, including our students, our teachers, staff, and their families. And so from that perspective, it will be incredibly important for us to understand where some of the challenges have been in terms of maybe not adhering to the processes that they set in place, maybe not having the right processes set in place to begin with, so that we can learn from them, not only to help to educate us as we look to eventually reopen our schools, but also to continue to ensure the safety of those schools who choose to move forward with opening. And so from that perspective, I know Dr. Gales, you've been working hand in hand with them, as well as Dr. Stoddard, in trying to ensure that those recommendations are adhered to and that they are primarily done in the interest of the safety of all of our community. But Dr. Gales, I want to go past that and go into what you had talked about before in terms of our transmission rates. Understanding that the state has moved into phase 3, and we know that we are not in a bubble here in Montgomery County, and some of our neighboring jurisdictions have embraced that, moving into phase 3 methodology. And we've seen the increases we've seen. What are your concerns? What are your recommendations for those who want to continue to keep themselves safe? How do folks continue to minimize their exposure? Can we just remind folks, because I think oftentimes, unfortunately, as time progresses, folks forget, folks get a little bit more lax in terms of what it is that they need to do to keep themselves safe. So if you can talk to the general populace about what it is we need to do to continue to be vigilant, and then I've got another question for you after that.
Okay, well, I'll try to be brief and succinct. So the first thing, to back to Councilmember Albanoz's point, we are working actually on simplifying our dashboard to be able to release something at home, taking the feedback we've heard from you all and others to give a clear indication of goalposts here's what we need to move forward. Here's what would happen if we need to move backwards. Because I think those are both conversations that we need to have in the event that the numbers move to a point where we don't see improvement and we actually have to talk about walking back, but certainly also, distilling it to a point where folks can see in a more simplistic way to understand what criteria need to be met to move forward to another phase. Now, as it relates to what we need to watch for, I think that the big challenge, and this informs the conversation about schools, it informs the conversation about new phases, is all of this has to be done in the setting of lower community transmission. And if we don't see lower community transmission, we can have lots of provisions in place. But for example, in schools, you can have lots of safety plans in place, but if folks after hours are going back to places where community transmission is higher, it's increasing the likelihood that they're bringing it into the school or their job or their restaurant or all of those places. And so that's what we have to continue to focus on, is driving that number down. It makes it increasingly challenging to do so, to your point, Councilmember Rice, when there are increased provisions across other places and we know people cross boundaries. So the things that we have to remember to do is remember to adhere to the guidelines. For example, we continue to see family gatherings tied to contact tracing. Now, the challenge is we all want to see our family. When we see our family, we want to hug, we want to be close because it's our family and we trust them, but we can't let down our guard when we're in those settings. Particularly if we are interacting with folks outside of our household, you've got to wear your face coverings. You've got to continue to wash your hands and put physical distancing in place, because even if there are family members or people we know and trust, we can still transmit the virus between one another. And so I think we have to remember to remain vigilant on those perspectives. I know it's been a long process and we still have a ways to go, but we can't forget those practices that have been put into place to keep us safe.
Thank you for being succinct, because I thought of another question that I want to throw in there in the mix. I know that I think it was either Alexandria or Arlington actually enacted a mask ordinance mandating that masks be worn outside as well as indoors. I'm curious as to your thoughts on that. And I'll just say this weekend I was out at Mattapique, the fishing pier there off of the Chesapeake Bay. Was on that fishing pier with a lot of people, trying to do my social distancing, but I wore my mask the entire time. And it's interesting because I would say about 95% of the people didn't. Is there a thought around having a mask instituted for outdoors?
So we do. So I guess we do have the mandate in place, and the language says, when physical distancing is not possible. We've not taken the step to just mandate it, period. And that's something that we can continue to discuss, particularly in the setting of increased cases and increased evidence where there's concern for lack of adherence.
Thank you, Mr. President. I know I'm at my 5 minutes.
Thank you. And if we have time, we'll come back, but to be
Please
fair,
put me on the list. I've got one more that's really important.
Okay,
Thank
all
you.
right, you're back on the list. Councilmember Friedson.
Thank you, Mr. President. Thank you, Dr. Gales, Dr. Stoddard, for the update. And obviously, we have to be vigilant. I will say to Councilmember Albornoz, I am also scheduled for a flu shot on Wednesday, first thing. So hopefully we all can do that. I will be putting out notice to residents just as a way to encourage other people to do it as well. So glad that you mentioned that, Councilmember Albornoz. And thank you, Dr. Gales, for mentioning the dashboard and the interest in streamlining it, making that even easier. As you know, I've been pushed for that originally. I think it has really helped. I think improving it will help even further to just be clear and consistent on what the metrics are so that everybody can point to the same place. So I really appreciate that. And I appreciate you highlighting the R0 numbers and the commitment to keep those updated on a regular basis. I think that's a really good shorthand for residents, albeit not perfect. It doesn't cover everything, as you have frequently told us, but it does give a shorthand to what the direction of the virus in terms of its transmission is going. I think it's really helpful for residents to be able to see that very easily and quickly. So thank you for that. Just a few questions, a number of issues I know you've been working on. I just wanted to get an update. One is related to religious institutions with the high holidays coming up. Dr. Stoddard, you and I have had significant conversations, and Dr. Gales, Dr. Stoddard, and all of us have spoken about this. I know there's an interest in trying to balance the public health concerns with community spread, with the unique needs of communities to be able to observe their faith, particularly at this important time of year. Just wanted to get a quick update of where that stands.
Sure. I think Dr. Stoddard will talk more about it. We actually talked yesterday, and I know that he and his team have been working to design some strategies to be able to do exactly what you said. So I won't step in if he wants to share it now or later. So.
Yeah, so we had a meeting with the larger faith community. Reverend Caseman and Ken Hartman helped organize that meeting. We talked with Dr. Gales and I about how we can, think about accommodations for increased capacity for houses of worship. We know the high holy days are approaching for many of the faith traditions. We are going to have a sit down where we specifically look at the guidelines beginning tomorrow. We try to increase the representation on the faith community work group that allows us to make sure that we're addressing more faith traditions. I'm hopeful that we'll be able to find some additional accommodations where we can increase capacity, but offset those increased capacities with some other strategies that allow for things that we're particularly concerned about. And so when we talk about our houses of worship, obviously the capacity is very large in terms of what they're permitted to operate inside spaces normally. And there are bottlenecks usually at the entries and exit ways. So if we can make those bottlenecks safer, we feel better about maybe some increased capacity in the houses in the sanctuary space or worship space itself. And so I think we're going to work with the faith community to have something that's multi-denominational in its considerations. And the hope is that we can do that relatively quickly to allow, I know Rosh Hashanah is on Saturday, begins on Saturday. Obviously, this is an interesting or challenging juxtaposition because we're seeing what's happening in Israel as well, where they're actually instituting new lockdowns on Friday. And so it's a challenging thing for particularly for the Jewish faith tradition right now, given the what's going on in Israel. Their holidays are starting very soon. And so we're going to work as quickly as we can to find some additional accommodations while trying to, obviously the big point is in the context of increasing cases, which I think Dr. Gales has laid out already, we want to make sure that we're not introducing additional risk to our community and to those who are going to worship.
Appreciate that. Then just a quick update on outdoor and indoor performances. County executive had sent a letter requesting up to 50. The governor has now allowed indoor for 150 for performances, outdoor up to 250, I believe. I know you all were working on figuring out what that was going to look like. I'd like to get an update on that. And I'm just going to go through, I had two others, and I'll let you just go through and give the update on all of them if that's okay. The others on the 10 p.m. rule for restaurants. Thank you, Dr. Stoddard, for participating yesterday in a really helpful discussion. There is definite buy-in from the businesses to try to work out any public health accommodations and to come up with a regulatory regime that can protect customers and workers, but also keep them in business. So I just want to get an update on timing there. And then lastly, the mask policy for sports related to heavy exertion with the American Academy of Pediatrics determination and any changes that may be coming up the pipeline for that related to soccer and others.
I can
go ahead. We've talked about it, but Earl's been on it, so I defer to him to speak, provide those. Yeah,
I'll probably. Dr. Yale can certainly add in. Obviously, his voice in this is paramount. So in the live performances issue, we spoke with the team that it does review the letters of approval, and what we've done essentially is we've developed a strategy that I believe will allow live performances outdoors to move forward, like as in very soon, as in likely this week. We'll be issuing that. We've developed guidelines, talked to Dr. Gales about those, and he's comfortable with the strategy, as comfortable as we can be in the setting of the community transmission where it is right now. And we're likely going to move forward with those this week. I just need to get them written into something that's actually presentable to the community. Indoor live performances, obviously. As part of my briefing, and I'll just say it now, the indoor spaces are continue to be incredibly concerning to us. Over the last 3 weeks, there's been at least a half dozen publications on the increased risk of indoor spaces as it relates to HVAC systems and their ability to recirculate virus indoors. And so, as we've talked about all along, we're very moved by the science on COVID-19. And so what we'd like to do is allow, I know we've only got probably at most 8 to 10 weeks of good outdoor weather that allow outdoor performances to continue at most. And so we'd like to get those in place first while we still continue to look at the indoor spaces. I know we've also have plans to sit down with some of the movie theater representatives to discuss that as well. I think it's just, we're trying to figure out how do we balance the risk that is becoming increasingly evident about indoor spaces with increased use of indoor spaces. And obviously this is something that's going to become increasingly important as we get closer to the fall and winter months. And, I think we're trying to balance all those things out. So we're going to likely start with outdoor live performances very soon, but as in very soon this week. But I think that the indoor ones are going to take a little bit longer because of the increased concern that we're seeing from the science. And then lastly, as you mentioned, we did have a meeting with the restaurant community yesterday to try and think about the 10 p.m. alcohol sales limitation, extending that potentially to midnight. What we're considering, and we have to write this up because I think the words actually matter in terms of the details here. I did discuss it with Dr. Gales, and he wants to see the full write-up before we proceed with it. But essentially, the concept is an opt-in program that would allow businesses to go from 10 p.m. to midnight with certain stipulations that they agree to, and they would have to provide staffing to whose specific job it was to enforce those rules during their operations. And then what would happen is if we do our county secondary enforcement, we'd have a list of businesses who have agreed to opt in. And if we went to those businesses and found them to be in violation of the things that they had committed to, we would rescind their approval and instead of just issuing a citation of $500, which for many businesses is frankly would be a cost of doing business if it were allowed. In this case, we would actually just remove their approval to do additional alcohol sales, which would have a much more significant way of enforcement for us. And so we're going to work that. We're going to draw those details up. The team has already been meeting this morning since our meeting yesterday to start writing those things up. I'm hopeful that we'll have a draft of that this week as well for our review and approval.
Thank you. Councilmember Navarro.
Thank you very much. Thank you so much for this update. I really appreciate the conversation about the flu shot. It was on my list of things to ask about since people are trying to make those decisions. I have my appointment on Thursday, but I think it is important to discuss why it is such a critical issue this year in particular. It is every year, but it's very important. Just a couple of things. So I'm already hearing from folks who are wondering about Halloween. And just curious, is there had been any conversations about just, general directive or messages to the community regarding Halloween?
So we've had some informal conversations about it. To be perfectly candid, we've kind of put it in the queue to get through the schools and the uptick. But it is on our radar, and we are aware that there are some other jurisdictions, including Los Angeles, who have put out some information related to it. And we've been keeping an eye out on them in other places. So be on the lookout for some language probably within the next week or so. And again, a large portion of it is dependent upon, community transmission and where we sit. Based upon where we are right now, it would not be recommended, in terms of that, or having more controlled focus events that don't have people going from house to house, again, increasing points of contact and potential transmission. So yeah, it's on our radar.
Yeah, I will only add that Clark from Public Health did actually take a look at the LA County guidelines, and I think that's something that we're likely to parallel. And I think Dr. Yells is a correct assessment. It's going to be one of those things where it's going to be one of those activities where person-to-person exchange is not going to be recommended. But frankly, given we know this is a community activity, it will likely be a list of recommendations that will say essentially, we're not recommending that you do this, but if you do this, we're definitely recommending that A, B, and C be followed, kind of, because obviously it's not a government or business owned activity that is trick or treating. So
absolutely. I appreciate the response to Councilmember Friedsen's comment and question regarding religious accommodations. Obviously, in my district, with a very large Jewish community, there is, interest in figuring out some kind of accommodation and compromise with the high holidays coming up. So I appreciate that response. And then lastly, I know I sent a memo with a screenshot of the intake form that was being used at the Wheaton testing site. And the translation in Spanish was just really subpar. And so I just want to make sure that, again, specifically because the questions that were translated in such a bizarre way are very critical to the information that we're trying to gather from these, residents who are going there to get tested. And that critical information informs, I think, a lot of our own, health data, composites, so that we can figure out what's going on, right? So things like, do you live in congregated spaces? I think was one of the questions. Or have you been hospitalized, with symptoms? So we really need to have that kind of information. And when the translation is just so strange, then we miss out on that. And so to the extent that, we can prioritize having someone who does that quality control, that would be really important as we seek to understand what is happening in some of our communities. I think that is paramount. So really wanted to bring that up again, because I know we've had this conversation a lot, and I know it's not up to you guys, but we do have and have invested in a lot of resources. And so was just curious as to, why this keeps happening. So just wanted to flag that again and hope that we can fix that ASAP so that the information we're gathering is accurate. That would be super important. And again, thank you for everything you continue to do. Appreciate it.
Thank you. Councilmember Glass.
Thank you, Mr. President. Thank you, my colleagues, for all the good questions. I'm just going to follow up on a few of them. Regarding the culture and entertainment opportunities that we've been talking about, and my colleagues have been talking about. Don't mind the helicopter overhead if you hear that. There's an interesting parallel between some of the religious institutions that actually operate in theaters, and then banning theaters from operating as cultural institutions, not religious institutions. And there are a number of those that operate here in Montgomery County as religious institutions. And so a number of theaters, particularly AFI in downtown Silver Spring, had reached out to me and asked if there could be some accommodation. And I have a number of other cultural and artistic organizations that have asked me about plans for this fall and this winter, quite frankly, with Nutcracker season upon us and other performances. And so I just want to drill down a little bit, because I think, Dr. Stoddard, you alluded to creating some regulations regarding outdoor entertainment opportunities. And as these organizations are planning, not beginning to plan, but as they are planning for their performances, can you enlighten us a little bit more about what those regulations might entail?
Yeah, so they're going to essentially focus on. Actually, I don't think I'm ready to show a draft, but I can certainly talk about one.
Sure.
So they're going to focus on the 50-person gathering limit, but what we have done is essentially you'll seek a letter of approval for your performance, and as part of that, you can request that your performers be considered as separate from that 50, so long as you set in place physical and process barriers that prevent the attendees and staff who work with the attendees from intermixing with their performance. So if you treat them as two different pools of people, you can address them, 50 for your audience and separate. Because I know that the cast and crews for some of these performances can be quite large themselves, and therefore, if you were limited to 50 total, it would be impossible to do an event where you'd have more people working at the event than they would actually attending it. And so, obviously, I think that that's how we've worked it. The other things that we've suggested is, number one, it not be walk up. You have to have tickets in advance, and that way, as part of the ticketing process, you would actually collect information from the person who's purchasing tickets that would allow for any contact tracing to occur from that individual. In addition, face coverings at all times for guests and theater staff interacting with guests, as well as performers when they're not doing the actual direct performance per se. And then finally, a few things where you have a performer before the run of show, you have a performer be tested before they do the run of show, and a temperature check for staff and performers before an individual performance. I think that summarizes most of the things on this list that I'm looking at here, and then sanitation and other sort of requirements. Those are essentially basically going to be the guidelines that are going to be provided for the outdoor performances.
Thank you for sharing that. I know some artistic leaders are listening right now. So while the regs aren't finalized and they're not public, that level of insight right now is helpful. And then I think a question that Councilmember Rice had asked before. I just want to drill down a little deeper. Now that the state has gone to phase 3, and I know that both you and Dr. Gales, Dr. Stoddard and Dr. Gales, are in conversation with your peers and colleagues throughout the state. What are you learning from them and their experiences as they've moved to stage 3, and while we have not?
I think the best way to put it is this way. Any of those of us who are in health recognize that moving towards a phase, increasing reopening where the burden of virus remains where it is going to produce new cases. And that's the reality that we're living in. And so we have been spending time trying to come up with strategies, anticipating that there are likely more cases to happen, as we have seen in our jurisdiction and we're seeing across the state and other places, how we deal with that, and making sure that we have the resources in place to deal with any potential increase in those particular cases. And I see the 5-minute rule, but I'll just say, we are nervous because we know that we've not achieved a lower level of community transmission. And by increasing the opportunity for activities to be open, we're nervous that could set us up for a potential significant increase in new cases across the state, even in the setting of lower hospitalizations or things like that.
I'll just add briefly, I know you're over time, but I think it's really important to say, I think that intrinsically when people see things opening up, they assume they're safe. And I don't think you should make that assumption about things that are opening up in all cases. And so it's incredibly important that you make personal decisions about your own health and safety and not necessarily always rely specifically on what's allowed to be done, just as a guide for what is safe for you to do. And I think that's an incredibly important piece to continue to remember.
Thank you.
Thank you. Dr. Gales, before I call on Councilmember Reamer, Councilmember Navarro had asked a question about the intake form issue and the Spanish language. Can you answer that? Do we need someone else? Do you need to get back to someone else to answer that? Where are we on that one?
So we were made aware of it. I know it's being actively addressed. It was discussed this morning in other conversations, and it's getting fixed as soon as possible because we share your concern. It's not okay. And I know that behind the scenes it's getting addressed to fix it as quickly as it can and be brought online, but also to address any type of systemic issues or process issues that led to it happening in the first place. So both short-term and long-term issues are being actively addressed as we speak.
Okay.
Thank you so much. And if somebody, and so I guess I'll wait to see the response to my office. I really do appreciate the attention paid to it. Thank you.
And if you could let all of us know, but especially Councilmember Navarro, please. Thank you. Councilmember Reamer.
Thank you. I want to follow up a bit on the comments from Councilmember Rice talking about schools. He and I have been talking about this issue a bit more. It's very concerning. The status quo path that we're on, I think we all have to ask ourselves if the level of viral transmission that we have today supports reopening MCPS. And if it doesn't, what are we going to do to change that? And I think we're all hoping that the steps that we've taken along the way would have more effect than they are having. But hope is not a plan. And right now, the schools are going to, the theoretical reopening of schools is late January. But what is going to change between now and then that's going to support driving the viral transmission numbers downward? What are we going to say in January? Are we implicitly saying that we think the schools could reopen under the current level of transmission? Or are we saying that it needs to be lower? We've got to start thinking about this more, because January is right around the corner. It's going to be here. And I think we could all, I would hope we'd all agree. I know Councilmember Rice certainly does as well, that if there's one thing we've got to do, it's help our kids get back to school. And the possibility that we'll be here, absent something that could happen, which is that in the winter, there's just a huge explosion of transmission. That's a possibility. But, if you assume it's the status quo, I don't know what the right assumption is. What are we going to do? Because it isn't the level that Dr. Gale said, moderate to low. And I point out, as I have in the past, that New York has lower transmission than we do. Their transmission is less than half ours. And even they're having trouble. I mean, the school system in the city wants to reopen. They've had to postpone that reopening. It's not even easy at that level. So I just think, we have got to figure out what path we're on. I am concerned. I'm comforted a bit by Dr. Stoddard. You said that each performance will need its own plan. That is, certainly there could be more controls in that. But I really am worried that we're on this path of gradual reopening. We're painting ourselves into a corner. And then we're going to have to decide, what do we do? Do we either send our kids back to school with the virus at its level, or do we just keep them home for the rest of the year? And that's a really difficult position for us to be in. So first of all, we need to talk about it more. Councilmember Rice and I have been talking about having some joint conversations with the board and the school system and the teachers. We need to really get honest here and be transparent with ourselves so that we can make a tough decision, whatever that might be. And I repeat, I wish I knew what, I'm sure Dr. Gale's wishes, but what would it take for us to get to the New York level? I think that's a question we have to really start asking. I heard Dr. Gale say last week that they're beginning to prepare contingency plans for what happens if the viral transmission rises, which is possible. So, Dr. Gales, I'll just turn it to you if you'd like to make any comments about reopening schools, or Dr. Stoddard, the path that we're on, what do we need to know as we look down the road here in the next couple months?
I'll do this really quickly. I know that actually Councilmember Friesen had one of his questions not answered, and I know it's something that you've also brought up, Councilmember Bremer, related to soccer and mask. We are actually updating the guidance around that, and we'll be putting forward that information with the updated AAP recommendations around that. So stay tuned. That is coming, and it will be coming sooner than later. I know we had a conversation around timelines before, so stay tuned. It's coming. That we actually talked about it this morning. And so as it relates to schools reopening, so this is the challenge, and it gets to some of the, the performances and things like that. We've got to drive numbers down to lower level. to be able to have lower community transmission, to be able to do things. And we fully recognize and are empathetic to the economic realities, the socio-emotional realities of reopening, things like that. But we also are guided by the health principles and recognize and understand the more we open up with higher levels of community transmission, the more we talk about painting ourselves into a corner, we're going to potentially be slammed by more cases due to that precarious balance and how we do that. Now, as it relates to schools, I know that MCPS is working on coming up with plans and strategies to be able to bring back some students who to their school settings before January. And I know that they also are going to look at the information and where we stand at the end of the first quarter to be able to make some other decisions around the totality of the entire school system and the ability to come back. Where we stand right now in terms of the numbers that were put forward by the state guidelines, there are some conversations in terms of that would qualify for hybrid conditions. The challenge is again, to drive down community transmission, we're going to probably have to have some more hard conversations about implementing public health strategies that may run counter to some of those economic conversations and those kind of things in terms of reopening. And so you referenced the state of New York. They're having some challenges in terms of reopening, dealing with unions and things like that. But the reason why New York and some of those other states in that area have been able to drive down their transmission is they kept things closed. And they kept things closed for a longer period of time that did not increase those activities. For example, they just reopened indoor restaurants at 25% capacity. So their phased-in approach in terms of reopening was much slower than many other states. And I think the second component of that influenced why numbers in New York have been driven down and have been able to be sustained is the public buy-in in terms of the effects of COVID-19. New York was slammed hard. The whole world watched New York's cases and what happened. And I will say this based upon, fortunately, I do get some nice emails through the day saying we're doing a good job, keep up the good work. We also get a lot of emails saying we're not that smart and we're not doing the right things and we need to move and open up things quickly. Part of that, I think, is influenced by we have not seen the level of severity, or at least some in our community have not seen the level of severity and impact of COVID-19 for it to really resonate and understand why we have restrictions in place. And I think that's going to be an ongoing challenge. Even now we have people say, well, the cases are up, but people aren't going to the hospital. No one's dying. So why not just open things up? Again, and we've had this conversation before, and to your point about status quo, I refuse to accept that as our status quo. And I refuse to accept that the best that we can do is having 80 to 90 cases a day. And we've got to continue to, look through how we can come up with policies and implement strategies and make sure people are following the restrictions to be able to drive that down. And that may, in fact, if the numbers go up, may introduce the possibility that we have to roll back provisions. And so that's why we're working to be, and certainly, we'll make sure that you all see that and a part of that conversation for your input. But we have to come up with a structure that lays out criteria to say to the general public, if we get to these points, we have to go back because we've got to drive the numbers down even more to get to that point. I hope that answers your question.
Thank you.
I know I've taken my time. I just want to close by saying, the council has not,
your time. Go ahead,
council has not criticized the closings. I think we would support continued closing if necessary, but rapid testing may be the solution. We need to be planning for wide deployment of rapid testing. That may be the solution.
And we are.
Thank you. And I do believe it should be noted, and we have talked about this before, but if wishes could solve this, we would have solved this a long time ago. This is obviously extremely serious business. We don't want to put anyone at risk, especially our children and the people that educate our children and every other person in Montgomery County and our loved ones. And we have to do this in a systematic and a proper way. Having said that, we also need to keep in mind that our businesses and everyone else are hurting and hemorrhaging in so many ways. So we have to figure out a way which is the best path forward. But we just can't say this is what we want. We have to figure out what we need. And with that, Councilmember Giwando.
Thank you, Mr. President. agree with your statement. Thank you, Dr. Gales, Dr. Stoddard, for all your work. Always start there because it's hard and it's important and it's not easy. This is a balancing act. We're trying to balance many, many factors. And I understand the inherent contradiction in these conversations that you're having with us and with the public about how do we keep everyone safe, but also how do we stretch this timeline? How do we get these things open? I understand that. And I think we all understand that. It's because we're dealing with an unprecedented pandemic. Following up on a couple of points that have been made, just so people know, I think sometimes people don't know exactly what's happening. What is the state guideline for hybrid reopening of in-person learning?
There is no clear definition of what qualifies as hybrid education. We've asked for that clarification and guidance, and we've not received any. And so as it stands, is hybrid reopening or hybrid guidelines is what it is. There's no, and even in the state guidelines that have been produced, there's no further definition of what constitutes and qualifies as hybrid education learning modules from the state's perspective.
Okay. I hadn't been able to find it either. I just wanted to make sure I wasn't looking in the wrong place.
Nope.
As far as Councilmember Reamer's line of questioning, we all want to do what we can to make sure we can reopen safely as quickly as possible, right? And if that means we have to shut things down, you've mentioned several times, what do we have to do to get our numbers past this stubborn level of, slight increase that we've seen? I think we want to know the sooner we do that, the better. What we don't want is a drip and drab, and then we're hit with the flu season. And, if things get worse, people are falling. I see it every day. People are falling into this false security of things being opened. And it's human nature. You see things gradually happening. You think the next step is going to happen. And people are getting more lax with face coverings and the like. And so I just really want to press that point of, in your opinion, and you both can answer this, do we need to right now start rolling things back so that we can avoid that type of slight increase that could lead to further increase down the road?
Well, I think we're actively, we're continuing to look at the contact tracing data. And, for example, when we saw contact tracing showing that it was affiliated or we saw a high number of cases associated with alcohol consumption in restaurants, we took that action. And so we're trying to be very intentional about what the data shows us in terms of being able to curb actions that are being shown to be tied to it. It's something that, we're actively thinking about because no one wants to see happen what you just described. And particularly the challenge is, again, going back to one of the earlier comments, is it's challenging when other areas across the state have provisions that do allow those opportunities. And we know people move back and forth the boundaries. I'll give an example. I know one county, there was a group who wanted to have an event. They had caps on their social gatherings, so they took their event and went to another jurisdiction. And that particular event had, I think, over 2,000 people participating. So you can see how the state guidance, and not agreeing with that makes it harder. But I will say, we continue to be dedicated looking at those things, and we'll have no issues. I know it will cause concern and potential controversy if we need to do that. But if, the recommendations from the health perspective will be to not blink if we need to do those, particularly if there are activities that we're finding are time and time again associated with an increase in cases.
I would appreciate that. Go ahead, Dr.
I would only add, one of the benefits that New York State certainly had is it had the state of New Jersey and the state of Connecticut also working with it pretty closely to all drive their numbers down concurrently. The challenge ultimately becomes, and this is the yin and yang, the balance of the challenges that we face. We could close everything down in Montgomery County, but because Frederick County is largely open, there's more things open in Prince George's, Northern Virginia, we couldn't guarantee if we closed everything down that our numbers would plummet in the way that we would hope that they would. And so we are now, I mean, they would certainly go down. I mean, that's pretty clear. How low they would go and where, you know, would they go to a level that we'd all feel comfortable opening schools? I don't know that we know the answer to that. But the choice then becomes, you know, do we do that and, you know, have greater economic impact disproportionately to our businesses and all the long-term ramifications there. And so it makes it a lot harder when you're trying to do it by yourself. And this is like when we were closing things down in the beginning, we said the same thing. We tried to build regional constructs for closing things down because they're way less effective to close them down by yourself than they are in the concept, you know, in the context of doing it as a unit, as a region, as a state, all those things. And so there is clearly no appetite at the state to close things down again. And that's the challenge that we're going to face, is that we would have to go it alone, and that's the problem.
Yeah. Well, I think that's very troubling in that I understand it, and it's not your doing, but the fact that you're saying that even if we went to, and I'm paraphrasing, if we closed everything down, we wouldn't be able to see the movement on the numbers because of what's happening elsewhere in the state. That speaks to me that we need to talk to county executive and us and others, to the regional partners, and try to do what we can, because that what you just said makes me think we're going to continue on where we're at with drip and drab.
We would see movement if we made individual level changes in Montgomery County. I don't want to say that we wouldn't, but we would not see the full impacts of what we're seeing in New York State, because we would be doing it as a much smaller unit surrounded by units that are not doing it. And so, yeah.
I appreciate it. My time is up, but thank you for the work you're doing. We'll continue to stand with you. Thank you.
Thank you. Vice President Hucker.
Thank you, Mr. President. Thank you both for everything you're doing. I appreciate the creative, targeted proposal regarding restaurants and the 10 p.m. rule that came up yesterday, so I look forward to the resolution of that. I followed Dr. Gale's advice in advance. I got my flu shot last week. I'm wondering if there are any plans, or whether we should make any plans for something that's been speculated about a little bit in the community, setting up outdoor flu shot pop-up clinics.
So to that end, and actually I would encourage you all, since you all have such a great reach within the community, when you do get your flu shots, put that on social media and get that out. It's important to show folks that you're doing it, and to encourage them to do so. So the team, we have an allocation of flu vaccine that we received from the state. And one of the things, the team is actually meeting at 11 o'clock. So they're meeting right now to talk about how to utilize some of those spaces to do public testing, for example, food distribution sites and the current test sites that we have, you know, for asymptomatic individuals to particularly get the vaccine. So we're actively working on those strategies and hope to be able to announce some things very soon.
Great. If you're in, you know, if you do go in that direction, I'd be happy to help organize and find locations and publicize them in my area. Thank you so much, Mr. President.
Thank you. And what we're going to do now is ask Dr. Stoddard. He's given some of his thoughts, but we're going to ask Dr. Stoddard. And then I have already on the list Councilmember Albornoz and Councilmember Rice, and that's how we're progressing. Dr. Stoddard, please.
I've covered many of my comments already in answering some questions, so that I'll keep my comments brief. I want to highlight a couple things. So actually today is September 15th. So today marks the day that FEMA actually has changed its policy around PPE, meaning that they're no longer going to cover PPE for things outside of what they call emergency protective measures, meaning the PPE that's utilized by first responders, hospital workers, and potentially some others, like maybe in a correctional settings. But what they're not specifically going to cover is face coverings in schools and other places where it's largely preventive in nature. And so fortunately, that policy only prospectively impacts the use of the purchase of PPE. And the county has been able to procure a significant amount of personal protective equipment that we will be processing through FEMA's request. We currently sit at 3.7 million N95 masks, 3.5 million surgical masks, over 110,000 face coverings or cloth face coverings. And so we've been able to secure we'll be in a significantly different place if there is a resurgence for COVID-19 in terms of PPE for the fall than we were in the spring, which I think is good news for everyone. We continue to look at the science, and I alluded to this some already with the indoor spaces. There was also a study that showed that buses can be a problem if you operate on the recirculator mode of your HVAC system in a bus. We've already worked with DOT that we do not do recirculation mode in our current buses. We take fresh air in from the outside, which obviously is a much less problematic situation. In addition, the science that we also continue to look at is the science around some of the potential long-term impacts for COVID-19. And there are a series of them that have been identified, and what's not clear is how frequent they really are and whether they are truly long-term, in the sense that, COVID-19 has been a human disease for less than a year at this point. And so we do not know if some of these, circulatory or heart-based illness side effects, or the neurologic impacts that have been seen or observed in the last couple months are long-term. But that's the science we continue to look at, and continues to spell out that we are still in a pandemic with a novel illness. We think we know a fair bit about this illness. We know far less about COVID-19 than we know about many things that we deal with all the time. And so I think it's still important to remember that there are those long-term challenges that we are concerned about. Phase 2 of our eviction prevention program with HHS and Department of Housing and Community Affairs launched last week. This will be a metrics-based targeted approach. We're actually attempting to predictably identify communities where eviction is more likely based on a series of data from a long period of time. And I think one thing that's really important that we understand is that, evictions get a lot of the attention, but typically where we see people losing housing is actually in the holdover or change of occupancy rate, much more than we see the actual formal legal eviction process playing out. People are typically pressured into moving long before their case is finalized in the court. And so we're obviously paying attention to the holdover rate and trying to understand what that means for long-term housing sustainability and suitability as it relates to COVID-19. And so we continue to do that work. One last thing I do want to talk about is elections. We are working to have a safe and effective, timely, both in-person and mail-in election process. We still encourage people to request their ballots via mail and to fill them out and submit them either via mail, U.S. Postal, or Dropbox that are available. Those people who do want to vote in person, we are going to make those voting sites as safe as we possibly can. We do continue to have a backlog of mail-in ballot applications. We peaked at about 95,000 last week. We're down to about a 75,000 backlog. We've been working with our existing Board of Elections staff as well as recreation staff that we've moved over to the Board of Elections temporarily to support the processing of those applications. They worked through the weekend. They did more than 22,000 ballot applications over the weekend, another 7,000 yesterday. So we've got that backlog coming down. The state will be opening up the processing center early next week to help with the processing of those ballots as well. And so obviously our goal is to have those be processed as quickly as possible. And at the end of the day, have everyone be able to participate in a safe and effective election come November. And so with that, I think that's all I had. And happy to entertain any additional questions.
Thank you, Councilmember Albernoz.
Thank you, Mr. President. So nothing like dealing with record-setting floods in the midst of a pandemic. So Dr. Stoddard, I want to thank you, the emergency management team, and all of our first responders, and Maryland National Capital Park and Planning, who did an outstanding job through all of that. But it does raise a question, and that's capacity. You mentioned the election coming up. Dr. Navarro, Councilmember Navarro brought up the issue of quality control with the questionnaire. And as we know, it's so critical for particularly our immigrant community to have a positive experience when accessing government services in this time of, there being distrust of government. And I've asked this question before, and I mean it sincerely. A story has not really been told about how hard county employees are engaging. You mentioned the Department of Recreation, shifting. They've also helped with, food delivery to seniors, helping at homeless shelters. I mean, everybody. It's been all hands on deck for quite some time now. And I am worried that as we go into the fall season, as we go into the winter, God forbid there's another surge, do both of you have confidence that we have the staff capacity and infrastructure in place to address any potential outbreaks, coupled with other challenges that we're facing on a parallel track? And if not, is there an opportunity? There are 150,000 county residents that have filed for unemployment, that are looking for work, that need something to turn to. Are there opportunities in the short term? Do we need opportunities to shore up some of that infrastructure to address some of these and other potential issues moving forward?
I would say it's definitely a challenge. I mean, there's no question about it, and I would point to both the county employees, but also our nonprofit partners, and frankly, private sector. I think everyone's feeling the stress of this long-term pandemic. I think, I won't go too far down the rabbit hole of mental health, but obviously that, it's incredibly important, and the stress that people are feeling right now, whether you're working on the pandemic or not, is incredible. I do have significant concerns about, with flooding. I said to someone, after the floods are over, this climate change is not going away. I mean, it's still a threat that it's posed to Montgomery County, and it's an increasing threat, and one that we have not been able to dedicate the time that I would like to have dedicated over the last 6 months to addressing. And so I think there's absolutely things that are not going to be as fully addressed as we would like them to be in light of COVID-19. That said, the challenges that we face are the pressures, the challenge that we really in expanding personnel isn't the total number of people necessarily, it's often skill set. And that's the trouble. It's like the same people who are asking to develop guidelines for how we safely can open a business are the same people who would be doing plan review for schools, or who would be, it's the same skill set expertise that you have to draw upon. And so, the folks in public health are being asked to do incredible efforts. And frankly, the people who, even within county government, who don't have the same skill set are, like you said, rec staff have stepped up considerably. So I think, and we've been trying to look for opportunities to bring up the question of stress management and mental health, and, making sure that those who are working within the system continue to operate within the system. I think we've been able to keep morale pretty high. I do think it is incredibly important that we continue to recognize people who are working very hard, because I think it's a big part of the morale boost. We spend a lot of time talking about what isn't working well. I think things like the food work are examples of things that are working as better than when we could have expected. And so I think that's incredibly important. If we have additional staffing needs, I think we have no question that will come to council for an additional request. I think the challenge that we're facing is the places where we're really facing the bottlenecks of staffing are in skill sets that are incredibly difficult to expand right now.
I appreciate that and all those comments, Dr. Stoddard. I know it's not an easy solution or answer, but we've said this many times. We'll continue to say we stand ready to support any of your guys' efforts, because we know how important all of this is. So thank you very much. I yield back to you, Mr. President.
Thank you very much. Councilmember Rice.
Well, thank you very much. So one of the very important questions I have for both Dr. Gales and Dr. Stoddard involves vaccinations, and it involves the clinical trials right now and the lack of people of color, both African Americans as well as our Latinx population. And so I'm curious as to whether or not folks have reached out to localities to ask for strategies. Has there been any conversation in the health arena as well as in the emergency management arena? Because again, a vaccination that isn't effective for a large part of our population, in fact, the majority of Montgomery County, would not be something that would be effective. And so from that perspective, what's been the conversation around how to involve our people of color in these vaccination studies? And are there additional resources that are necessary? Do we need to be involved and engaged in this process? What's the game plan that we're hearing from the state as well as from the federal government, from these private corporations that are creating this, oftentimes that are within our own jurisdiction here in Montgomery County that are working on some of these vaccinations? So can you just give me an idea of what the lay of the land is when it comes to the status of vaccinations and our people of color?
Sure. So we, as you mentioned, we don't actually participate necessarily in terms of being a direct participant in the vaccine trials in terms of executing the strategies. Now, there are roles in terms of, talking it up within different communities because, NIH is in Montgomery County and NIH is one of the leading participants in terms of conducting these trials. I will say as a note of encouragement, yesterday, some colleagues from GW, they are one of the sites for vaccine trial. Over 50% of their participants actually are of color. So there are some promising local examples where there has been good recruitment and outreach in those communities, recognizing, and I'll find the link and I'll send it to you under separate cover. So there are some pockets that show good recruitment. And that is promising because everything you mentioned is entirely correct. We want to make sure that we do have a good representation of folk of color within those trials to understand if there are any new biological nuances or different responses in terms of the vaccine. And ultimately, when we do disseminate the vaccine, when we get one, we're going to get one, when we get one, we want people in the community to understand that they can trust it because they know that people who look like them have been a part of it and don't feel, I have family members who, historically from the flu shot have said, the flu shot's not for us. It's not for people of color, so I'm not going to trust it. I'm not going to get it. And, the scientific basis, I can't, present a study that demonstrates that. But we know historically over time, we've not been represented in those studies. So it's not difficult to understand why someone would have some reticence or hesitance to do that, participate. And quite frankly, when we do get a vaccine, we don't have time to have to deal with it. We need everybody to be on board and to feel comfortable. So I say all that to say that we will, at least from our standpoint, work to provide more information to the relevant groups who are doing the work within the community to make sure they understand if there are opportunities to participate in trials. We encourage them to do so. And certainly as we hear more stories about good representation and recruitment, we'll make them available to you all to address those concerns.
Dr. Gales, it also might be helpful for us to know which local companies are actually working on vaccinations and doing trials. And Mr. President, it may be something where us, the county council and the county executive might want to pin a letter saying that these local these local companies who are residing here in this area should utilize the great wealth of diversity that we have to ensure that their trials are representative of not only the community, but also fostering the trust of that community in the efficacy of those vaccinations. And so from that perspective, maybe that's something, of course, up to my colleagues, but certainly something I'd be willing to certainly sign on to. And hopefully with some guidance from Dr. Gales, Dr. Stoddard, we can craft something that would encourage folks to do just that, especially NIH, a great partner of ours who's right here in Montgomery County. So thank you.
Well, thank you. And I think that makes a lot of sense. I mean, obviously the public partners, but there's the private partners who I know, many of whom we've met the people who are running the companies, and they certainly want to make certain that people are comfortable and that they have the fair representation. So I think that is something, Dr. Gales and Dr. Stoddard, I know you need one more thing to do, but if you could help us write that letter, we'd appreciate it. And with that, I see no other speakers. And now, Dr. Crowell was on, I believe. Are you still on, Dr. Crowell? No? Okay. Well, thank you very much.